plantar fasciosis. Okay, in this position, in his normal street clothes, he can lie in a lateral position, in a comfortable position, a little cushion beneath his ankle here for comfort. I'm going to make a mark with a permanent marker where his plantar fasciosis is most painful, right here. That's the center of the treatment point and what we will refer to for treatment purposes as the hub of his treatment. I'll take some grid paper, cut in 3 by 3 squares. I won't quite center that on the painful portion, but I'll arrange it so that he has 2 squares on the bottom surface of the foot and 1 square along the medial surface of the foot. And we'll apply this tattoo by simply blotting it with an alcohol-soaked sponge. Rubbing alcohol, make sure it's quite wet, and then peel the decal off. Here is our center point for the most painful area. I'll be treating this entire treatment field, beginning with most of the pulses stacked on this hub of the treatment area. After stacking some of the radiofrequency pulses on the hub to deliver maximum heating effect to that most painful area, then I'll treat in a series of radial spokes out from that hub in opposite directions throughout the treatment field. The idea behind using the spokes is to allow minimal time for cooling of the tissue with each pass. So we'll treat along this spoke, treat that spoke again, treat that spoke a 3rd time, and it retains the heat. This is the handpiece. We apply a disposable treatment tip to the end of it. At each of the 4 corners of this treatment tip, thermistors will project a cooling effect to the skin. Then the center will project a column of electromagnetic energy to generate the heat in the deeper tissues. That'll be followed by a very brief delivery of the refrigerant a 2nd time. So it goes cool, heat, cool. The return pad for this energy is connected to the machine. We'll apply the return pad to the opposite side of the ankle. And be sure that it's closely applied on all edges. This is some liquid coupling fluid. It ensures complete contact of the disposable tip to the skin. Give a dry sponge back there. To ensure that we don't short-circuit this radiofrequency energy, I'm going to apply a dry sponge on this edge of the return pad to be sure that none of the coupling fluid flows down to contact the coupling pad. That would short-circuit the energy from this part of the skin to the return pad through the coupling fluid, instead of allowing the energy to flow through his plantar fasciitis, or instead of allowing the energy to flow through his plantar fascia and then seek the return pad. So this is really important. Be sure that the coupling fluid does not short-circuit the energy pathway. Okay, so if we have a look at the face of the machine, there are three simple controls on the front of this machine that we'll use. This one turns the machine on and off. This one dials the energy level that's delivered. This one confirms the energy level setting before the machine is turned on again. So three very simple controls. And at any time during the treatment process, the energy can be adjusted up or can be adjusted down according to the patient's comfort tolerance. Okay? Okay, to begin the treatment, is my knee in your way, Rodney?
No, I'm close on his foot.
All right. So to begin the treatment, we'll apply one pulse directly to the most sensitive area in the hub of the treatment field. I may need to adjust the energy level up, apply it again, adjust it up again, apply it again, until it is at tolerable comfort, but definitely is perceived as intense heat in the sole of his foot. So we'll stay with that setting, and I'm going to stack 1, 2, 3, up to 10 successive pulses in the most tender portion of the foot. Now I'm going to treat the entire grid field in a series of spokes. I don't want to take a lot of time between pulses because the circulation in the bottom of the foot will dissipate the heat and allow the tissue to cool. So very quickly, I will come out this radius or this spoke of treatment with overlapping pulses, always beginning at the painful hub, for 3 successive passes of overlapping pulses. Then, because this is going to feel hot to the patient, I'll go to the opposite side and treat a series of pulses along a shorter spoke. This one will require only 3 overlapping pulses for 3 passes. Then again, to come to an opposing rested treatment area, I'll take this spoke three passes, 4 overlapping pulses on the longer spoke. And the grid simply allows me to keep track of where I have treated and where I have not. I go to the opposite side, a short spoke, 3 stacked pulses, again to the opposite side, another radius, and between treatments I want to ensure that I have adequate coupling fluid in the treatment area. So I'll use an opposing finger here to smear it, and at the same time appreciate the increasing temperature in the skin with my index finger. The system is smart enough to know how hot the temperature, or the system is hot enough to know how hot the skin surface is. But my human mind needs to appreciate it as well. Now I'll come to the opposite side. Remember, with this treatment field protocol, I'm reaching the plantar fascia both from the sole of the foot and from the medial aspect of the foot. So my distance to the plantar fascia ranges from approximately 11 millimeters to 13 millimeters of depth. Now, this is getting quite hot in this area. He's complaining just a little bit. I'll come to the machine, turn the energy level down a half a notch, restart it again, and treat it with a lower setting of energy, but much more tolerable for the patient. Once I've completed treatment of stacking at the hub, treating each of the spokes out from the center, I'll come back to the hub and stack another series of 6 or 8 remaining pulses directly over that most sensitive area. If it's really warm for the patient, I'll say, this is going to be a hot pulse, so only 2 to go. Grit your teeth. We'll be through in a moment. Very good. That's the entire treatment field, maintaining the heat concentration in each of the spokes. Then we'll take a dry sponge to wipe the coupling fluid off, an alcohol-soaked sponge to scrub the decal off, we'll remove the return pad, and the treatment is complete. It takes about 8 minutes, maybe 10, to treat this entire 3x3 grid on the plantar surface of the foot, and we'll wait 6 weeks to determine if a second treatment is necessary. Usually we need to treat these issues twice, 2 successive treatments, 6 weeks apart. A few people get better after just 1 treatment, and so they beat the rap, so to speak, but he's prepared to come back in 6 weeks again if necessary.